We talk a lot about trust in dentistry. Patients need to trust you. Build trust before you present treatment. Trust leads to case acceptance. But let me ask this, what is trust? What is it really? It's not a warm feeling. It's not a personality trait. It's not something you magically that just shows up after you've explained enough dentistry. Trust in a clinical setting is something that's earned, and it's earned through specific moments, small deliberate actions that tell a patient, you see me, you hear me, you care about me, not just my teeth. Trust is built when patients feel safe. Most dental patients, especially those facing complex care, walk in with their guard up. They've had past experiences that didn't go well. They've seen treatment plans they couldn't afford. They felt rushed, judged, or overwhelmed. So before they trust your diagnosis, before they trust your technology, they need to trust you. Trust is built the moment a patient realizes this doctor gets with what I'm dealing with. That moment doesn't come from a chart. It doesn't come from a perfect explanation. It comes from a conversation that starts with them. Trust sounds like asking, well, what brings you in today? And really listening. It sounds like noticing body language and saying, you seem unsure. You want to take a minute to talk through this? It sounds like saying, when you're ready, we'll be here. Trust is never forced. It's never rushed. It's earned by making space for the patient's story, their fears, their schedule, their priorities. Trust isn't about agreement. It's about alignment. Here's something most dentists miss. Trust doesn't mean the patient agrees with everything right away. It means they feel safe enough to explore it with you. They may not be ready for the whole plan today, but if they trust you, they'll tell you what matters most right now, and they'll come back because the relationship is intact. Trust is what keeps the door open, even when the patient isn't ready to walk through it yet. So, how do you know when you've earned trust? Well, you know it because the tone changes. Patients soften. They ask more honest questions. They say things like, okay, well, what would you do if you were me? Or, this actually feels doable. You see, those moments don't come from lectures. They come from connection. The bottom line is trust isn't a personality you have. It's an experience you create. It's created when patients feel understood, when they feel unpressured, when the conversation sounds more like a relationship and less like a report. And the best part, you don't need 30 years in the chair to build trust. You just need the courage to slow down, to get curious, and lead patients in a way that makes them feel safe by saying yes. And if they're not ready for care, they come back when they are. Trust is durable.